All right, so today we're going to be doing some neuromodulator to the masseter muscles. So neuromodulator like Botox, Xeomin, or Dysport. Why we do it is for a couple of reasons. So you could get neuro to your masseters if you just want to slim the face, which is very, very common to do. If you have like a really strong jawline, you just want to slim it a little bit. Or if you have TMJ, so that means if you grind a lot, especially at night, and wake up with headaches, jaw aches, it can actually lead to gum erosion as well as bone erosion, and it can even lead to loss of teeth. So this treatment we're going to be doing right throughout this area. It's virtually painless and it takes about a minute to do. Results can last anywhere between 3 to anywhere like 4 to 6 months. Okay, so we're going to go ahead and get started. Are you ready?
Let's do it.
All right, so I'm going to have you clench for me. Perfect. And then relax and then clench again. So are you a grinder in your sleep?
Oh, yes.
Yeah. So clench one last time and you can see the muscle bulge. So let's have you relax for me and we're going to get started right throughout here. 1, 2, 3. And we're going to treat the entirety of the muscle. Hillary, I'll switch with you if you don't mind. How are you feeling?
Great.
Not too bad?
Mm-mm.
All right, clench one more time and then relax. Perfect. You want to be very careful not to get any other muscle that you're not intending to treat. And we'll get one more. And as you can see, this procedure does require quite a bit of product to get the muscle to relax sufficiently. And then one more time, if you can clench. And relax. We're going to get the belly of the muscle right down here. So it's important to go to a board certified dermatologist to do this because you want to make sure you're targeting just the muscle that you want to target and nothing else around it. Because if you really don't know your anatomy, and if you notice what I'm injecting, I'm using my thumb to tell me exactly where to inject and where to not inject, because if you inject where you don't want to, you can actually cause paralysis of the smile muscles. Specifically the zygomaticus major, and Zia here will have slightly sort of weakened smile and asymmetrical smile that can last for up to months. So that's something we want to avoid. All right, so we're all done. As you can tell, it is very quick, fairly painless. The results take up to a full 2 weeks to kick in, so you have to be patient. I always want to see my patients back in about 2 weeks to see if it still needs a touch-up or anything like that, or if you need to put more. But Zia should be feeling much better in about 2 weeks.